All right. Okay. Good afternoon, everyone. Thank you all so much for joining us today here for an event that we'd like to talk about celebrating the birthday of the Affordable Care Act. But before we do get started, we wanted to take a moment at the top to recognize the senseless tragedy and the shooting that has occurred, both, of course, in Atlanta and then just recently in Boulder, Colorado, where I think we certainly have a lot of thoughts and feelings and sending out sentiments for folks there. So did want to start off with a moment of silence for the families affected and the senseless tragedy of gun violence and across the U.S. Well, thank you all very much for taking a moment to recognize. And of course, we're here today to really recognize and talk about the Affordable Care Act and the 11 years that it's had since it was signed into law by President Obama. My name is David. I'm the regional director with For Future Florida for East Central Florida, here joined by some wonderful panelists that are really going to talk to us more about the Affordable Care Act, what it has meant for them, and really the impact it has had for individuals and families across the U.S. And I'd love to start by introducing Mina with Young Invincibles. Could you tell us a little bit about yourself and your organization?
Sure. Thanks, David. Hi, everybody. Thank you, David. Thank you to For Our Future for having me here for this celebration today. My name is Mina Schultz. I'm the ACA Outreach and Enrollment Program Manager at Young Invincibles. Young Invincibles is a national 501c3 research and advocacy nonprofit committed to lifting up the voices of young adults in the political process and it's expanding economic opportunity for those aged 18 to 34. We work on a range of issues that impact young people but from our beginnings, we've advocated for universal access to affordable health coverage and have worked really hard over the years to build on the foundations set by the Affordable Care Act. So I'm really excited to be here to talk about some of those foundations with you today and all the progress that we're continuing to make.
Thank you so much, Mina. And of course, also joined by Ann Packham, who's of course also here in Central Florida, and of course has gone to collaborate with For Our Future in the region as well. So really, thanks for joining us. And could you tell us a little bit more about yourself and what you do?
Thank you, David, for inviting me. Yes, so I'm Ann Packham, and I am here in Orlando, right here in Central Florida. And I work for a nonprofit called Primary Care Access Network, also known as PCAN. PCAN is dedicated to making sure that people have access to primary care and as well as a source of payment for that care, which is through health insurance. So what I do is I'm a health insurance navigator. A navigator is a position that was created under the Affordable Care Act to assist people in understanding how the Affordable Care Act works, how do they get health insurance, how do they sign up, how do they get the financial help, and then how to use their health insurance once they have it. So I work every day on the ground here with Central Floridians, and sometimes now, because we have the virtual space, people across the state, in choosing a plan, understanding, what they're getting out of that plan, and helping people transition to Medicare when they turn 65, or helping young people when they turn 26 and lose their parents' coverage and have never had insurance on their own. So everything, all age groups, and we're really happy to be here and to help people with that enrollment process.
So we'll definitely appreciate you taking the time, especially with open enrollment, to join us today and really kind of share out about it. And then, of course, here we do have Laura Packard. Really thank you as well for joining. And could you tell us a little bit about yourself and as well for what you do?
Hi, David, and thank you for having me. My name is Laura Packard, and I'm the Executive Director of Get America Covered, which is a national nonprofit that does advocacy work around the Affordable Care Act, letting people know how to get covered. And I'm also the founder of Healthcare Voices, a nonprofit organizing adults with serious medical conditions.
Well, wonderful having all of you to join today and really to really talk about today and the significance of March 23rd, which of course here, of course, we are recognizing is a birthday for Obamacare, as it is also called, the Affordable Care Act, all together on this date 11 years ago. So I did want to say, of course, that it's been 11 years for a lot of people. It's been a very impactful policy, but it hasn't been around, obviously, forever. And I think recognizing where healthcare was and how it's changed is something we'd like to start off with. So really, before Obamacare, I did want to ask, leading in with Laura, what was healthcare like before the Affordable Care Act?
Well, I can tell you about that because I experienced it. I used to have a junk insurance policy before the ACA, and if I still had that insurance policy today, I wouldn't be here. Because insurance companies could deny you coverage if you had a pre-existing condition. So they could just refuse to cover you at any price. Or they could cancel your coverage if you got sick or injured. They could find some pretext, some reason to cancel your policies because it's cheaper to pay lawyers than to pay for healthcare. And this used to be called rescission, but it's something that the Affordable Care Act put an end to.
Speaking of pre-existing conditions, did everybody here know that before the ACA, just being a woman was considered a pre-existing condition? Women could be charged more for coverage. They could experience waiting periods before they could access benefits. And many of the benefits needed by women, like maternity care and many forms of birth control, just weren't covered. The landscape was difficult for young people too. When a young person aged off their parents' insurance at either 18, when they left school or left for school or any reason really, they had very few options for getting covered and even fewer if they had a pre-existing condition. So finding a job at 18 or right out of college that offers health insurance is difficult to say the least, and buying individual coverage could be prohibitively expensive before the ACA. And at that time, many plans on the individual market did not have to cover benefits that were needed by young adults. So, what was the point of spending hard-earned money if you couldn't even access care anyway? So we know young adults value having health coverage, but pre-ACA, there just were simply too many barriers placed in their way.
So, David, do you want me to go ahead and jump in? I'll talk a little bit about the history. We've talked about how things were before the ACA. So the ACA was actually the Patient Protection Affordable Care Act, was signed by President Obama this date 11 years ago. And what it did was try to figure out ways to address a lot of the inequities that we have in healthcare. So most of our focus today and in the conversation in the media is about the Obamacare and the marketplace, but there are a lot of other provisions within the Affordable Care Act that help people with employer-based coverage, for example. So not only do the ACA plans or the marketplace plans have to be comprehensive, like was mentioned, but employer plans have to be comprehensive as well. Young people can stay on their parents' plan until they turn 26 and can't be denied for pre-existing conditions, even through employer coverage. It also required, there's other provisions in it that require hospitals to do certain things to keep people, from re-entry into care and things like that. So I think it's important to remember that the ACA was trying to address a lot of economic inequities and healthcare inequities. It may not have achieved all of those because essentially our healthcare system didn't change. We still have fee-for-service doctors. We still have hospitals that negotiate with insurance companies to charge prices that a lot of people find are unaffordable. But it made a huge advance in our system, and it made the access to care increase for millions and millions of individuals, including those who were able to get Medicaid as a result of the expansion under the Affordable Care Act. So that's a little bit about the history of where we're coming from coming into today's anniversary.
So, definitely thanks for that perspective and kind of noting where it was before. Do want to take a look at the impact that the Affordable Care Act had, and I know Young Invincibles got to share this graphic with us. Could you walk us through a little bit about what we see here?
Absolutely. So young people actually have the highest uninsured rate of any age group. But with the passage of the Affordable Care Act, we've seen immense progress being made with that. So the uninsured rate for young people has been cut in half since the implementation of the ACA, with 9.2 million young adults gaining coverage either through their parents' plan, through Medicaid expansion, or on the individual market. Over 30 million young people with pre-existing conditions can no longer be denied coverage or charged more due to their health history. And over 62 million people have gained access to no-cost birth control. But it's not just young people who have benefited from the ACA, and I'll let Anne talk a little bit more about how others have benefited.
Yeah, so I think there is a lot of focus because it has such a big impact on young people. But here, especially in Central Florida, we have thousands and thousands of people who are in, let's say, their late 50s, early 60s, right? So they're too young to qualify for Medicare, but yet they've decided to retire, or they need to work part-time, perhaps because they're taking care of an elderly relative or an adult child, and they need coverage as well. So this has been hugely important for those individuals because now they can get help financially paying for the coverage. And by the way, the older you get, the more expensive the coverage gets. So somebody who's 60 years old is looking at a premium that could be easily $600, $700 a month or higher for a low deductible plan. So it's very expensive as you get older. And so having that financial help has been key. Also, people, when you turn certain ages, you need certain tests, right, that are now free under the Affordable Care Act. So, for example, your screening mammogram is covered free of charge. Your colonoscopy, which is recommended between 45 and 50 years old, that is covered free of charge. Your vaccines are covered free of charge. So I think it's important to focus on all the different age groups. And then finally, we don't talk too much about that sort of middle age group, but we're talking about people maybe in their 30s or 40s who thought they had that dream job that provided health insurance coverage, but maybe they want to start off and do their own business. And they were very entrepreneurial, but as a small business owner, you don't have health insurance. You have to insure yourself. So there's a big group of people in that middle category who we also are really benefiting from the Affordable Care Act that can finally quit maybe that job that was holding them because of the benefits, strike out on their own, start their own business, and know that they can get coverage without worrying about pre-existing conditions through the individual marketplace. So it really affects all demographics of our society.
And a lot of this is, of course, talking about really what's on paper with the Affordable Care Act and kind of structural and actual changes that occurred. But we did want to cover in and talk a little bit about what the impact has had in terms of the stories that it's produced. And did want to open up for everyone that's had personal experience with Obamacare. How has this impacted you in your own life and with your own experiences?
I can start us off with that. The ACA has been very near and dear to me for a number of years. In the spring of 2011, I was planning to be uninsured for a few months while I was transitioning from graduate school to the workforce. Since I was under 26 years old at the time, my parents offered to let me jump on their plan. Just in the meantime, thanks to a brand new law called the Affordable Care Act. So I took advantage of that opportunity. A few weeks after my graduation, I was diagnosed with osteosarcoma, which is a pretty aggressive form of bone cancer. It's important to note that if I had been uninsured during that time, I really probably would not have had the MRI that caught my cancer early enough to treat it. There was no way I could have afforded an MRI, which run hundreds and even sometimes thousands of dollars. And I would have gone on just icing and elevating to no avail until it was too late. But because I was covered, I was able to access all the services I needed to get better. I received 27 doses of chemotherapy, 5 surgeries, physical therapy to relearn how to walk, and the mental health care to help me keep my mind as clear as possible through all of it. All thanks to a pretty sizable provision under the ACA that allowed me to stay on my parents' insurance because I was under 26. I lived most of that year in the hospital. I spent my birthday hooked up to supplemental oxygen, fighting an infection that almost killed me. My knee surgery to remove the cancer and insert a new titanium joint cost more than my mom's house. But none of it bankrupted my family because the ACA limits how much patients are responsible for out of pocket, and it prohibits insurance companies from capping care. I'm excited to say that I'm a few months away from hitting my 10-year cancer-free anniversary. Really exciting. I'm hoping that all goes well because I've made it this far. But I'm still left with several chronic conditions as a result of all the chemotherapy that I received. So I require ongoing testing and care. 11 years ago, before the ACA, my experience would have made me uninsurable right now. And there's no way I would have been able to access the care that I need to make sure I stay healthy. So prior to my cancer experience, I was a language teacher. I taught French and was planning to go into the Peace Corps to teach English abroad. But cancer and the help that I received from the ACA kind of changed my trajectory a little bit. Today, I'm working to make sure that other people are able to get the same quality health coverage that I had so that they don't have to worry about going bankrupt when they need care. Because when you're sick, you should really be focusing on getting better, not on whether or not you're going to make rent or be able to afford your next meal. And so, yeah, that's why I'm proud to be here today with all of you and all these great panelists commemorating this special piece of legislation and the work ahead to get every single person covered in this country.
Thanks, Mina. And Obamacare has also affected me personally. Over 10 years ago, in 2009, I moved out to Arkansas and helped get the Affordable Care Act passed in the first place, never realizing that it was going to save my life many years later. Because 4 years ago, I walked into a doctor's office with a nagging cough and walked out with a stage 4 cancer diagnosis. I never could have afforded the 6 months of chemotherapy and the month of radiation I needed without the insurance I had through the Affordable Care Act, because it costs over $500,000 to save my life and to put me in remission today. So I had junk insurance before the ACA, and if I still had that insurance, I would be bankrupt or dead. So Obamacare saved my life, but it's affected everyone one way or another. 135 million Americans have pre-existing conditions, and many of us would be uninsurable without it. And the things that we take for granted that Anne mentioned, being able to get no-cost mammograms, regular checkups, all those things we didn't necessarily have before the ACA. So it's helped millions of Americans, including me.
And I'll just continue on from there. So I'm a little bit different from the rest of the panelists in the sense that I've never been on a marketplace plan. Strangely enough, I've had insurance through my spouse's employer the entire 11 years that we've had the Affordable Care Act. But the fact that employers have to include comprehensive coverage is really huge, because before the Affordable Care Act, whether or not an employer would even offer coverage, right, was up to them. And this way, they are required to, with certain sizes of employees, to offer coverage. And what's that also has done is that small businesses, they want to compete for those workers as well. So they've done, what we've seen recently is some small businesses have started offering their employees financial help to get onto the marketplace, because they want their employees to be healthy. They want their employees to get their checkups. They don't want their employees to be missing work because of something that they could have prevented early, but now they're really sick with. So that's really affected people all over. I also have to say, I had mentioned when we were talking earlier that I'm the mother of triplets. And, you know, when my children were in the NICU, I wondered how much does this cost, right? I really didn't know. And I can imagine families having that same scary feeling of having a premature child in the NICU. And if before the Affordable Care Act, their insurance company could say, well, you know, your child has received $500,000 worth of care and they've been in the NICU for 30 days, and we're going to end your coverage. And that parent would have had to make a really life and death decision as to whether to go bankrupt and leave their child in the hospital, assuming the hospital would keep the child without insurance, or you know, they had to make really life and death decisions. So I think that's really important for us to imagine that the bigger parts of the legislation, how they've affected insurance for everybody. I wanted to close with I helped a woman get insurance. This is about 2 years ago. She called me in January, so after the open enrollment period had finished, and she had been working at one of our major theme parks, and she was let go after being there for 20 years. And she was really blindsided by it. She didn't know why she had lost her job. She had never been without insurance before. And I talked her through the whole process. And when I called her in the fall the next year to re-up during open enrollment, I said, you know, how was it going? And she said, you saved my life. And I said, what do you mean? And she said, well, I got the coverage and I went for my screening colonoscopy like you told me to do, because I always tell people use the free benefits that are available on your plan. Discovered I had colon cancer, and they were able to do she had a couple of surgeries, she had chemotherapy. And she said, if I had not listened to you and got the coverage and, you know, taken advantage of the free colonoscopy, I wouldn't be here today. So the impacts are far and wide of the Affordable Care Act.
That last example definitely certainly speaks to me, and I know that you know, in different states there's different levels of implementations. But when I was living in the state of Kentucky, and I was fully employed, and then my experience ended, and I didn't have employment, and I had coverage that was then lost. Being in a state where the Medicaid was expanded, and I was an eligible person to be on it, to have continual healthcare coverage, even when I was out of work and still looking, was incredibly helpful. Otherwise, you know, I think a lot of younger people might just sort of, you know, go without for a period of time. And I think we know that, you know, all these examples here today are ways in which these preventative measures are really the life-saving measures, and having continual coverage is, of course, crucially important. And talking about Medicaid, did want to lead into, of course, where we're at with the recent changes that we've had, and you know, to a great degree, help is here with the passage of the recent American Rescue Plan. There are some significant changes to the Affordable Care Act in terms of subsidies, in terms of expansions, and did want to cover a few of these. Of course, the first one, of course, is people with lower incomes. Coverage will be, or certainly can be, free. If you're a person earning between $13,000, $19,000 a year, getting covered could be as low as just $0 a month. And I think in a lot of states, a lot of places, that's because of Medicaid expansions and the willingness for states to really take advantage of that to cover more people in their states is going to be a really important provision, and something that really do hope we can take advantage of here in Florida.
David, let me just jump in there. That first provision there about the 13 to 15, that's not anything to do with Medicaid expansion. That's expansion of the subsidies that are available to people under the Affordable Care Act who earn less than 150%. So this actually is particularly going to be useful in non-expansion states like Florida, where there aren't any other options beside the marketplace. So I just wanted to make that clarification on that one.
Yeah, that's really great to hear, of course. And another thing, of course, financial help, it's expansive outside of just the lowest of incomes, 40,000 a year, and even more. I know a lot of these came from figures came from the Young Invincibles organization, and just wanted to see how you'd add on to this, or what other details you'd like to clarify.
Sure, yeah. Financial help to lower monthly costs has always been available on the health insurance marketplace at healthcare.gov or whichever marketplace your state uses. They've been there from the start, but with American Rescue Plan, that help is about to get a big boost. So like David said, people with very low income will now be able to get fully subsidized coverage, which means they'll be able to get financial help that they will be able, so they'll be able to get covered for $0 a month. The same goes for folks who have received unemployment benefits. No matter what your income is, if you received unemployment even for just a week this year, you can qualify for the most generous financial help to cover your monthly premiums. And then for those with moderate incomes, they'll see their financial help increase to the extent that some people might see their financial help double. So double the financial help, that'll bring premiums down a huge amount for those folks. And then even if you've looked at healthcare.gov before and you didn't find anything that worked for you, I encourage you to go back and look again, because those with moderate or higher incomes who previously didn't qualify for financial help can now find that they may qualify for financial help. So you might find the right plan for cheaper than you think. One caveat I'd like to add about that is that the financial help that is going to be available doesn't start until April 1st at healthcare.gov. So while I definitely encourage everyone to go to healthcare.gov and get covered now, that extra help is not going to be available up front until April 1st.
And I think that'll lead us into recognizing and talking about the open enrollment period. And I know Anne is here to really talk about this and what are the options people have.
Yes, David. So, I mean, technically, the government is calling it a special enrollment period, but we personally call it the special open enrollment, right? Because it acts like an open enrollment period in the sense that anybody can get on the marketplace during that time, even if you didn't have a change of job or, anything like that. So we're coming up, on May 15th is the deadline to do that. And as was mentioned previously, so on April 1st, when you go into the marketplace, the financial help that'll be available to you will look different than if you go in today, for example. So I worked with a young gal yesterday who needed to update her income because she's changed jobs since January. And we did one set of assumptions, and her plan went from being almost $200 a month to about $33 a month because her income has reduced significantly. But I said to her, your plan will actually cost you about $5 a month once April 1st kicks in because of the new provisions. So we encourage everybody to, work with one of a navigator. Of course, we always encourage people to work with a navigator. Why do we do that? Because a lot of people go on the marketplace or they call the call center and they may not get the best information, or they don't get the localized information. When you work with a navigator, you're working with somebody who's familiar with your local hospital systems. They're familiar with the local plans and which ones cover which ones you can use at with this doctors. So we're more familiar with the local situation, and we're free anyway. So why wouldn't you call us? And we can really talk through it. I think the issue of those who have unemployment insurance, that's going to be a little bit tricky because what we're hearing from CMS is that the provisions that allow people with less than 100% poverty level who've received unemployment, those may not be implemented on April 1st right away. So we'd have to work with those individuals to see if we could estimate their income based on the insurance they're getting, the unemployment benefits they're getting from the state, the federal government, looking and seeing if they're doing any other kind of work to make sure that they can take full advantage of these provisions while healthcare.gov is being updated. So our phone number is obviously on the slide, and we encourage you to, obviously schedule an appointment. And if you're looking at this from someplace outside of Florida, you can also go to healthcare.gov, right? And there's an icon that says find local help. You put in your zip code and the local navigators, assisters, and also agents and brokers are all listed there, so you can find somebody who can help you in your local area. I really encourage people to do that.
Definitely. Well, definitely looking forward to seeing what kind of benefits will come along in April, and did want to continue along here to just kind of have our own call to action here, recognizing around and having a conversation for the Affordable Care Act, which Young Invincibles is really leading on today. Could you tell us about what this afternoon looks like?
Absolutely. So our conversation here is going to be ending soon, I know, but we invite you all to continue the party throughout the day. We're using the hashtag ACA11 to post your stories and reflections on the impact that the ACA has had on your community over the years. We're posting across social media, Twitter, Facebook, Instagram, wherever your pleasure. Just share your stories. We are also hosting at 3 p.m. Eastern a Twitter chat. We'll be discussing how far we've come and all we have to celebrate today, including these great new subsidies and the current special enrollment period. We're going to be talking about the landscape, and we'd love to see you at 3 p.m.
We'll certainly look forward to participating as well with For Our Future. And we're also, for those that are in Florida and our audience here, we do want to, make an engagement, especially on the engaging with our local officials, our state reps, our state senators, and of course, our governor, Ron DeSantis, to really expand Medicaid in Florida, which is where we have a petition here. You can go to forflorida.us/ACA11, and it'll take you to our petition, and you can just enter in your own zip code. It'll take you to just a couple minutes. A great way to make our voices heard to the people that are really able to write our laws, and then of course approve or veto the laws. And we really want to see that expansion really come to pass, as it would really extend coverage to hundreds of thousands of people in the state. And wanted to mention that here as well. So once again here, wanted to thank all of our panelists for joining here in today's event. Really, of course, together we aspire to make a better future. And here's some information for the organizations and the groups that have been here, and of course ways to really identify and get coverage. So you can see more about us For Our Future, for flfuture.org, to find out ways to get involved in the state. What are some great ways to connect with Young Invincibles, and hear from everyone else before we close out?
Well, again, thank you, David, and For Our Future for putting this awesome event on today. The ACA has meant so much to me over the years. It's been near and dear to my heart from the very beginning, and it's just really touching to be with all of you here, seeing that you feel the same. It's really exciting for me that all these new opportunities for people to get access to affordable coverage are happening. It's so important given the current public health crisis that we're finding ourselves in. And I just want to note the ACA has always been meant to be a foundation off of which to build a better, more universal system of coverage and care. So while there's still a lot of progress to be made, I'm more confident than ever that we're going to get there. So thanks for having me today.
And I'm going to go ahead and just jump in. I do appreciate being invited here. I like to be part of this work here in Central Florida. We have so many people on the marketplace in Florida, so we have a big constituency. We have a lot of people with a lot to lose if the ACA were to go away, and we have a lot of people who have a lot to gain if we had Medicaid expansion. So I appreciate being invited here. I also wanted to mention that our website is coveringcfl.net, like covering Central Florida. And you can go there and you can access information about the Affordable Care Act, about how the marketplace works, and how to schedule with a navigator. So again, if you're out there thinking, I don't know about this, I don't know if I need this insurance, I don't know what it's going to cost, I tried this before and it didn't work, any of those excuses, just throw those out the window and give us a call, or go to our website and, see what you have. Really nothing to lose but a couple of minutes, and maybe we can help you get insurance that will save your life, like some of the panelists that are on here today.
Thank you, David, and for our future, for putting this on and for sharing the importance of getting covered, because millions of Americans still don't have insurance, and now it's more affordable than ever. So if you have any questions, if you want to spread the word, you can go to getamericacovered.org and go to healthcare.gov to get covered.
Well, thank you everyone for joining in. March 23rd, very special day in history and very special day for people that are really needing healthcare. And wanted to end today by just saying happy birthday, Obamacare, and thank you all for joining in today. Hope you all have a wonderful rest of your days. Thanks everyone for joining and watching.
Thanks.